Welcome to your worst nightmare. In Overdrive. NightMare Overdrive is the name of the main attraction in this horror-themed amusement park. This spookfest will be going over 3 optic neuropathies secondary to demyelinating disease, a very spooky subject. Remember, follow park rules and hold on tight, as this park will take you on a myelin-bending journey. Our first stop is a typical carnival game called multiple band toss. Let this typical game be a symbol for typical optic neuritis, which may be the initial presentation of multiple sclerosis. This is a single-player game where a player is given several bands. The bands are tossed with the aim of landing a band around the shortest spike on the coffin. If you land it, you win a prize. This game costs 40 tickets to play. Let the ticket cost in this sketch be a symbol for visual acuity, with vision loss in the affected eye averaging around 20/40 in typical optic neuritis. Let this one young woman participating in multiple band toss be a reminder that typical optic neuritis is often unilateral and more often in young women, around age 20 to 45 years old. Lucky her! She got to be one of the first patrons to play today thanks to her Rapid Pass badge around her neck. Because optic nerve dysfunction is usually unilateral, a relative afferent pupillary defect is present. Let this badge be a reminder of RAPD. What's a spook fest without a cool costume? Notice her pirate-themed attire and eye patch. 90% of patients with typical optic neuritis complain of ocular pain, which may precede vision loss and is worsened by eye movement. Let her eye patch be a symbol for this pain. Another useful diagnostic test when suspecting any demyelinating disease is a lumbar puncture, which is used to evaluate the cerebral spinal fluid. The presence of CSF-specific oligoclonal bands is typically found in multiple sclerosis. Let these bands be a reminder of oligoclonal bands. Very nice! Looks like our pirate landed the band on the shortest spike on the coffin. Let this short spike be a symbol for the short anterior enhancement of the optic nerve on MRI in typical optic neuritis. For landing the band on the shortest spike, as promised, our pirate wins a toy plushie. Looks like she recovered on those 40 tickets that cost her to play. Typical optic neuritis spontaneously recovers in 1 to 2 weeks with very good long-term visual prognosis. Let our pirate winning a toy plushie in this sketch be a symbol for recovery. All that band tossing is hard work. Let's have a spooky snack. Another characteristic MRI finding associated with multiple sclerosis is called Dawson's fingers. These are lesions that appear as finger-like projections radiating outward from the periventricular white matter. Let this Dawson's finger foods vendor selling white popcorn and plastic gloves be a spooky symbol for this white matter finding. Let's now turn our attention to Mount Mog. Magic the Gathering, anyone? Mog is a type of goblin in this classic card game. Anyways, myelin oligodendrocyte glycoprotein optic neuritis, or MOG, is another demyelinating disease. Unlike typical optic neuritis, MOG optic neuritis is considered atypical. Notice all the children in this sketch. MOG antibody disease is more frequently identified in children compared to the other demyelinating disorders. Since there are more activities at Mount Mog, it makes sense that this play center costs more, 100 tickets to enter. A symbol for average visual acuity of 2100 in the affected eye. Let's take a ride on the Mount Mog slides. Notice the spinal cord-shaped ladder leading up to the top of the slides. On spinal MRI, MOG is associated with swelling and enhancement of the spinal cord, usually less than 3 vertebral segments. Notice the shape of the tunnel slides. Notice how there are 2 of them. Unlike typical optic neuritis, MOG can affect both optic nerves. Compared to the short enhancing segment of the optic nerve in typical optic neuritis, MOG optic neuritis may have extensive enhancement of the optic nerves and can even involve more than 50% of the nerve's lengths. Enhancement of the outer optic nerve sheath is called optic perineuritis. This is a classic finding in MOG optic neuritis. Let these tunnel-shaped slides be a symbol for involvement of the optic nerve sheaths. Uh-oh. Looks like this child had a bumpy ride on the MOG slide. Luckily, this amusement park is equipped with a first aid team. Let this first aid responder be a symbol for acute disseminated encephalomyelitis, or ADEM. Children less than 9 years old who are positive for MOG antibodies more frequently present with a disease called ADEM and may present with optic neuritis later in life. ADEM is characterized by widespread inflammation of the brain and spinal cord, which often occurs after a viral infection or after a vaccination, and children can present with confusion, weakness, numbness, ataxia, headache, and blurry vision. All that fun warrants a tasty treat. Notice the cotton candy at Mount MOG. In both ADEM and MOG antibody disease, lesions are often described as large, fluffy, and cloud-like on MRI. This irregularly shaped and patchy appearance of lesions can be found in both the brain and spinal cord. Let's now turn our attention to this water balloon shootout game at Mount MOG. This is a 2-player game where players use a water gun to shoot at discs, which fills up a balloon. The first to fill the balloon entirely wins a prize. Notice that there is a gray balloon and white balloon. Unlike the white periventricular lesions or Dawson's fingers in multiple sclerosis, MOG antibody disease typically affects both gray and white matter. Let these discs our 2 players are shooting at represent the optic nerve heads. Moderate to severe optic disc edema is a classic differentiating feature of MOG optic neuritis compared to multiple sclerosis and other forms of optic neuritis. Looks like we have a winner. Just like in typical optic neuritis, spontaneous visual recovery may occur in MOG, as represented once again by the toy plushie. And now, at last, the main attraction. Get ready for a drop that will strip you of your nerves. Welcome to NightMare Overdrive. Since this is the main attraction, this ride will set you back a whopping 200 tickets. Neuromyelitis optica, or NMO, presents with more severe vision loss with an average of 2200 vision. During the acute phase, patients can sometimes even be completely blind in the affected eye. Like MOG, NMO-associated disease is frequently bilateral. Let this 2-rider seat on this demyelinating drop ride be a reminder of that. Notice the long spine on this ride. Myelitis, or spinal cord inflammation, is frequent in this disease, affecting long segments, usually more than 3 vertebral segments as compared to MOG. Whoa! The riders weren't expecting that. Notice the 4 water jets soaking our 2 riders. NMO is associated with specific antibodies against the astrocytic aquaporin-4 water channel, which is a membrane protein concentrated in the optic nerves, posterior brain, and spinal cord. Let these 4 water jets be a reminder of this important antibody. Notice the cross or even chiasmal formation of these water jets. When there is chiasmal enhancement on imaging, think NMO. Are the riders okay? Looks like one is entirely passed out. NMO is associated with symptomatic narcolepsy due to involvement of the medulla. Take a look at the other rider in the post-ride area. She is nauseous and vomiting. Let the post-ride area be a symbol for area postrema. Area postrema syndrome can also develop in NMO due to involvement of the medulla. Additionally, intractable hiccups may occur. Notice how there was no prize plushie for riding NightMare Overdrive. Unlike the other demyelinating diseases, NMO attacks are more severe, and many patients are left with substantial residual deficits including severe vision loss or paralysis, and are less likely to spontaneously recover. Thanks for visiting this spooky themed park. I hope your axons are still intact. Let's now quickly summarize the main differences between these demyelinating diseases. In typical optic neuritis, vision loss affects young women and only one eye, which results in an RAPD. Vision loss is typically mild. Pain with eye movements usually precedes vision loss as demonstrated by our pirate's eye patch. Typical optic neuritis may be the initial presentation of multiple sclerosis, which is associated with oligoclonal bands in the CSF, as represented by the multiple band toss game. On MRI, there is short enhancement of the optic nerve as characterized by the short spike in this coffin. Spontaneous visual recovery occurs as demonstrated by her winning the toy plushie. On MRI, Dawson's fingers may be seen in multiple sclerosis, which are periventricular white matter lesions. Let's now look at Mount MOG. MOG antibody disease is more commonly diagnosed in children and typically bilateral, with vision loss being more severe. On MRI, both spine enhancement and perineural enhancement are common findings. Children with a history of acute disseminated encephalomyelitis, or ADEM, may present with MOG optic neuritis later in life. Let our first aid responder be a reminder of this association. Compared to Dawson's fingers seen in multiple sclerosis, MOG and ADEM can present with fluffy or cloud-like lesions on MRI, as represented by the cotton candy. Unlike typical optic neuritis, severe optic nerve edema can be seen in MOG as represented by the water balloon shootout game. Note the gray and white balloons representing both gray and white matter involvement. Like typical optic neuritis, spontaneous recovery is the rule. Our main attraction, NightMare Overdrive, presents with the most severe vision loss and least likely to spontaneously recover, hence no toy plushie for riding this ride. NMO has longer spine enhancement as represented by the design of this drop and is typically bilateral. This disease can present with enhancement of the optic chiasm and is associated with aquaporin 4 antibodies. Other associated symptoms include symptomatic narcolepsy as presented by our passed-out passenger and area postrema syndrome as represented by our nauseous and vomiting passenger in the post-ride area. Intractable hiccups may also occur. To close the sketch, notice the faint roller coaster in the background. These demyelinating diseases can relapse, with the frequency of relapses varying. Let the winding roller coaster in the background be a symbol for this. Lastly, the mainstay of treatment, especially in acute relapses, are corticosteroids. Long-term management to prevent relapses include plasmapheresis and immunomodulating therapies. Let this worker at the park modulating electricity be a symbol for immunomodulation.